her skin, looking for any lesions, any wounds, any scars, any irregular moles. Scars could tell us medical history. So also looking for any striae, which old ones would be a white or silvery. Fresh ones would be purple or red, and that can indicate some ascites going on. So now I'm going to assess her shape. So from her xiphoid process to her hip bone, since I can draw a straight line, she's straight, we would call this flat. So if that line was to go in, that would be, we'd call it scaphoid, which could indicate some malnourishment. If that line was to go up, we'd call that rounded. If it was to have that classic rounded, that pot belly shape, like an infant belly would be, we'd actually call that protuberant, and that can also indicate some ascites or peritonitis going on. So our next step is auscultation. So I would listen to want to hear 5 to 30 like clicks and gurgles through each quadrant. We're going to start in the right lower quadrant, since that is where our track of our mobility. So that's our first area. We're going to hear bowel sounds come back after surgery, a colectomy, bowel surgery, or anesthesia. So we're going to start right here in our right lower quadrant. Want to hear 5 to 30 in each quadrant, which would we'd call that normoactive. So we're just going to move in a little zigzag pattern, and we're listening to 5 to 30 of those little clicks and gurgles. So just kind of moving in a little zigzag pattern. Ears are definitely gurgling at me. So, and that was with our diaphragm. Our next thing, we are going to move it over to our bell, and we're actually going to listen to our arteries. So we're going to start with our abdominal artery. We're listening for any bruits. So it's one of those low swoosh sounds. So that indicates some atherosclerotic or like an aneurysm. So, all right. So now we're gonna listen to her renal arteries, which are about 3 inches from the midline. And now moving to her iliac. And we could even move down into her femorals, which would be down here in her groin. So now we're going to switch back over to our diaphragm. We want to listen to any friction rubs. So in our liver, those friction rubs are going to sound much higher pitch. So listening for like a sandpaper, like your fingers rubbing together. Our little spleen back here, it's hidden away. Our next thing we're going to move to is percussion. So percussion does take some practice. So we are going to start with our same clockwise, our right lower quadrant, listening for that timpani, which is the drum-like sound, the sound you get when you're tapping your cheek. That is pads of our fingers, and we're just palpating for any just like skin lesions, bumps, just that kind of light, anything closer top. And then we would move to our deep palpation. So moving in, once again, doing that clockwise. Unless that is the area that pain is in, we would want to do that last, just because that would tense up everything else and be very uncomfortable for the patient. So so with palpation, there are 2 methods we can palpate our liver with. One, we would just slide our fingers up into this costomarginal space here, have her take a deep breath, and got a little boop from the liver. So, or we can try the hooking method, which would slide our fingers right under this space. Deep breath for me. And felt a little boop from the liver. So that tells me liver's not enlarged because it is able to move around. So, and we would call a Murphy's sign. We'd hold pressure up here in that upper quadrant and have her take a deep breath. And if she was to have pain, that could indicate an inflamed gallbladder. It's usually hiding behind that liver, but it can be, when it's inflamed, be popping out. So a positive Murphy's sign could indicate an inflamed gallbladder. So essentially spleen stays hidden back here, but would be the same thing. Might be able to feel that pop out if there was any, if it was inflamed as well. So a few of our techniques, we're going to look for appendicitis. So we are going to find that McBurney's point. So it is in the middle of the diagonal line from her umbilicus to her hip bone. So in here, so we try a rebound test. So we'd rapidly let it go if she had any pain to indicate appendicitis or